Welcome to the Living Loud and Proud podcast, brought to you by Disability Pride, Pennsylvania. If you need a link to the transcript for this episode, please visit our accessible website at www.disabilitypridepa.org/podcast. And now, here is your host.
Hi, I'm Ellen Shimberg. Welcome to Living Loud and Proud Disability Conversations. I am thrilled today to be able to welcome Roberta Boch-Parker. We're going to be having a conversation about the Alliance for Headache Disorders Advocacy. The Alliance is advocating for equitable policies for those impacted by headache disorders. Founded in 2008, the AHDA is a nonprofit whose members include doctors, scientists, caregivers, and people suffering from migraines. We'd like to thank Highmark Whole Care for sponsoring today's episode. And without further ado, let me introduce myself. I'm Ellen Shimberg, the Chief Strategy Officer for Disability Pride, Pennsylvania. And my guest, as I mentioned before, is Roberta Boch-Parker, an advocate and ally for folks with headache disorders. Roberta, I'd love to give you the platform to introduce yourself, say hello to our listeners, and then we can jump into our conversation.
Hi, Ellen. Thank you for having me here today. I'm really pleased to be able to speak with you and to your listeners about migraine and headache disorders. I myself am a patient. I'm not one of the many experts that you listed there, but on some level, I do feel like I am a sort of expert. I've suffered from migraine disease for over 30 years, and my mother was a migraine patient, and my daughter is a migraine patient. So, I have the patient perspective, but I also have the caregiver perspective also. I had to deal with a lot in terms of doctors and health insurance, but also the education system, making sure that my daughter got what she needed in terms of accessibility and access to school. So, like I said, I'm not a doctor, not a scientist, but on some level, I feel like I'm my own expert, of course, on my own disease here.
I know that from previous conversations with you, of course, you have migraine, you said your daughter and your mother. What got you into advocacy work? What was did you have like a watershed moment that said, I need to do something more than just sort of consult with my physicians?
Well, for years, I, of course, found myself advocating for myself. There's a lot of stigma associated with migraine. People are not always very nice when they don't understand what's going on. Sometimes they just look at you strangely, like, why are you wearing sunglasses inside? Why are you slurring your words? Are you drunk? Hey, you're at work. What's going on with you? So then I'd get feedback from other people, learn that people are talking about me behind my back. And so, I of course didn't like that. So I take upon myself to try to educate others, so I wouldn't have to hear about those things. But eventually I learned to live with some of that, and I did a decent job of educating the, circle of friends or coworkers around me. But eventually, my daughter was diagnosed with migraine, and it sort of started all over again. I had to educate yet another group of people. And some of them included like the parents of her classmates, but also her classmates. And actually that was a bit of a challenge, teaching children about something like this. But, ultimately, it was during the pandemic with COVID. That's when I really felt the need to get involved to help others. So I also suffer from autoimmune disease. And so during the pandemic, I was not allowed to go out because I had a suppressed immune system. And so that was basically a rule for me. And so I couldn't get to the store to get things that I needed. And I started thinking about, well, that's just a rule in my case, but what about people who literally cannot I wasn't allowed to walk into a store, but I thought about, what about somebody who literally cannot walk into a store? How are they getting the things that they need? And it really opened my eyes. And so, of course, like anybody else, I was doing a lot of online shopping. But once again, the accessibility kept popping up because I did have some special needs, even in terms of online shopping. I have a special diet that goes along with the autoimmune issues. And so I had difficulty finding things that I needed. Of course, we all heard about supply chain demand, that sort of thing. But, when the prices started to skyrocket on these sorts of things, once again, there was, the sense of inequity. It's
Right.
These are things that I need to live. They weren't just things to tide over, the boredom during the pandemic. These were necessities that I couldn't get. And fortunately for me, they weren't dire. But once again, I started thinking, what if my life depended on these things? And I started thinking about the other people who, were not, and they were in more difficult situation than I was in. And so, I wanted to help other people. And because of that, it just didn't seem fair. And, I wanted
That was the genesis for it.
Yeah.
I think a lot of times what happens is we go along in our life and then we sort of hit a stumbling block, and that sort of opens our eyes to other issues that are carrying on. I know that my work with disability pride has made me much more tuned into how is the sidewalk blocked? If I was in a wheelchair, if I had mobility issues, how would I navigate this? And I think for those of us who, I think sometimes it does take the impact of something happening to sort of really open our eyes to see sort of what the inequities really are. And then we become aware of how unbelievably imbalanced so much of the stuff that we take for granted actually is. And so you are having a greater understanding of not only the issues about folks suffering, with migraines, but sort of the autoimmune. And I think COVID really opened people's eyes to how have folks managed prior to COVID? There's been generations of people who've had access and issues. And here we are, all these years later, still focusing on some of the same things. Tell me a little bit about the advocacy work that you're doing. It was interesting to hear, and I wasn't aware that that young school children had migraines, and I can't imagine how challenging it must be for a younger child also to have a teacher who doesn't maybe understand. I heard what you said about people asking if you were drunk during the day because you're suffering from migraine. I think there's a lot of stigma, I agree with you, attached to it. So I'm assuming the approach to how we talk with young children and their teachers and how adults manage it are a little bit different. And how did you help your daughter navigate through this, and her teachers and her peers and those other things? I think that would be interesting to parents listening in who have young children with migraines, and how you navigated that path for her or with her.
In the beginning, we didn't know exactly what was going on because it doesn't always present the same. So even amongst adults, migraine can present differently from adult to adult, but it can and often does look different in children. And so she was about kindergarten age when she started having the migraines, but they were abdominal migraines. And so, she complained of these horrible tummy aches, and, we're looking at, gastrointestinal type of roots. And here she was, we came to learn that she was having migraines. And so, in terms of advocating for her at first, you contact the teacher. But I didn't realize how prevalent the migraines would become for her. So at first it wasn't quite as difficult. It was, more of a concern for her comfort, that sort of thing, letting teachers know if she's complaining of symptoms like this or that, could you please contact me because it's a migraine. And so there were certain symptoms that it would be understandable that a teacher might overlook, just send her to the nurse's office and let her rest, that sort of thing. But it did get to the point where they were routine enough that at least I could recognize. So I would try to train teachers because some of them would just let her, try to walk it off or, try to push through, that sort of thing. And, these are things that would usually last for an episode, could be hours long or it could be days long. And so, I had to say to them, like cut the kid a break. And, so if she starts presenting with these symptoms, just contact me and I'll just come get her. So that's sort of how that started. But over time, the migraines became more frequent. And, I'd get emails about missed classwork and so forth, which, it is understandable. But sometimes there was like a little bit of an attitude with the email. Teachers are tired of it. And I can understand, that does make more work for them. And so I had to reiterate, this isn't a choice. She really is sick. And then so they would believe that for a little while, but then they sort of came back again, sort of questioning, what's going on? Is she really sick? And I said, yes, she is. And then it would be a matter of, well, I don't understand though. How can she be fine 1 minute? She was just out playing on the playground. And then as soon as we get in the building, now she's sick. And things along those lines. And so I'd have to explain, well, she probably was fine on the playground, but she's exerting herself, or it's a sunny day, and those wonderful things actually triggered the migraine. And even the change in lighting from, bright sunshine to, fluorescent lights, So I said, yeah, she probably was fine. And so these things that you're questioning are actually somewhat typical. And so once again, believe her when she says, she's having a migraine or if she's in pain. There came a point where, my daughter came to me in tears because she overheard one of the administrators at her school calling into doubt, like the validity of migraines at all. And that was shocking, that an educated person basically didn't believe in migraines. And so, I received a few emails. And if I could back up a little bit, we sort of went through phases, from lower school to middle school to upper school. So it was sort of like with each transition, I had to, step in and re-educate a whole new group of people. And so she overheard this comment and came to me in tears. And at that time, I guess she was having, a spate of migraines. And so, the email started coming home then. And, there was a little bit of an attitude. And she actually got, I don't know if they actually assigned her detention, but she was written up, so to speak, because she didn't go to the right place at the school. They sent her off to go see the nurse because she has a migraine. Well, the nurse's office was full, so she was sent to the library. Well, they couldn't find her at some point. So she got in trouble for not reporting back to say the nurse's office is full. So that's when I sort of, really stepped up and went off on them and said, look, you're lucky, you're lucky she went to the library. If that were me, you would have found me laying on the floor up against the lockers, because the headache symptoms are debilitating. And, you need to take her seriously. And also, it's really cruel of you to send her walking all over the building to find a place to rest. And it just went back to, you should have just called me in the first place and I would have come and picked up my child.
But you can imagine, and and I know that you've mentioned your thing, as parents, it's kind of drop and run and go to the school and drop and run and go to the school. And I think this dovetails really nicely into the work that you're doing with the Alliance for Headache Disorders Advocacy. And if you can tell me a little bit about what that work looks like and what is the sort of the goal of the organization and their advocacy work. What are you guys trying to accomplish?
Well, again, I'm just, a patient advocate. And so I don't work for them per se, but they did, I started with them, I suppose you could say in January, and that's when they started training advocates from all over the country. This year we had all 50 states represented. And so, overall the goals are to bring inclusiveness and equity, to the treatment of migraine patients, to reduce stigma, and educate the general public as well. But in terms of the headache on the Hill, which they've been doing, off the top of my head, I can't remember how long they've been doing it. I think for 17 years now. It's a long time. This past year was my first year participating. So I'm not sure how long they've been doing it. But, we convened on Washington on Capitol Hill. I joke saying I'm taking my migraine to Capitol Hill. And we met with legislative staff. Some people are lucky and they get to meet with the actual legislator, but their congressional staffers were great to work with, and they listened to our asks. We had several asks this year. One of them being funding for veterans treatments through the VHA. And I'm happy to say that I believe they just released money for this past year. So the previous year's ask came through. But while I was there, we were asking for next year. So just like regular people like myself, we're in Washington, D.C., lobbying. We're not official lobbyists, but we're lobbying Congress for effective change for migraine and headache disorders patients. One of the things, again, this sort of ties into my own personal story. I have a migraine interest, but once you start focusing on one interest like that, it crosses over into other areas. And so, one of the asks was we asked that they co-sponsor the NIH Clinical Trial Diversity Act. So, for instance, a lot of women get migraines, and actually, a lot of indigenous peoples, I believe they're the ones with the highest population of migraine, but they're not represented in the research. It's usually white men that they study in terms of migraine, but they're not the biggest population of migraine sufferers. But so in this case, we're asking for more inclusivity and diversity in the research trials, and again, that's not just for migraine research; that's across the board for any kind of research through the NIH. And so again, and asking for some help with our migraine situation, we're actually asking for help for others with disabilities. Another thing that we were asking for was the passage of the Safe Step Act. And again, it's, we're asking in terms of migraine patients, but this is, again, something that helps anybody. There's basically like a trial and error procedure in terms of getting medication. Like it's a fail first requirement that insurance companies require. So there may be a specific medication for your particular disease, but your insurance company may not approve it because they want you to try something else. We're asking that, let's let the doctor be the expert here. And if the doctor feels that, you need a particular medication, that, it should just be approved. You shouldn't have to jump through all these hoops. Like in my case, I went for several years through trial and error, trying all sorts of different medications, and they were not effective. And in some cases, they were sort of torturous, actually. I had some real difficulty with them, only to be told, we'll give it a little longer. And I was finally approved for Botox for migraine. And, it was wonderful. It started working right away. And then I got a letter from my insurance company saying, you're no longer approved. And they wanted me to do the trial and error. So unfortunately, because I had been through so much already, by chance, I already checked all those boxes. So they wanted me to go through the trial and error, and here I had already done that.
Would you say that your experience in terms of not having the doctor's prescription be filled right away, those kind of are typical for folks with migraines, where it's just not that they often have to jump through several hoops in order to get insurance approval?
Things may be changing, but yes, I belong to a few online groups in terms of these new migraine medications. And so, you might see the commercials like, hey, here's this wonder drug. And it looks like it's going to, cure your migraine. But a lot of people are saying like, oh, I've had to fight to get the medication. And so I believe, I've been fortunate for the past couple of years because I have a wonderful neurologist who, kind of fights for me. So, when I was denied my treatment, they were on it before I even knew what was actually happening. So, but I from what I'm hearing, a lot of people do have difficulty with that. They are forced to go through it. And I believe a lot of them are medications that aren't necessarily, specific for migraine, but they have been found to be helpful.
Botox being a prime example of a medication that was not necessarily originally slated for migraine and discovered to have multiple uses across other spectrums. I know other folks using Botox in ways that I know that had not been originally planned. The work and the advocacy work that you're doing in terms of having migraine sort of fall, I'm assuming as a disability, I'm assuming then that looking for accommodations in the same way under the ADA. So someone who has a migraine would need to ask for accommodations at work. And what those accommodations would look like. And I'm assuming it's individualized based on the person. There's not going to be a one size fits all for everybody, but a general policy about accommodations.
It is. And with school too. So for myself, back when I was working, I did eventually have to leave my job because the migraines became too disabling for me. At the time, my accommodations were easy enough. I was allowed to turn the lights off in my office, shut my door, that sort of thing. But for my daughter, they gave her extra time for schoolwork, that sort of thing. She was excused extra absences. And again, referring back to COVID, one of the benefits to come out of that was that we did learn that accommodations are possible. Ironically, they were offering people accommodations. People without disabilities were being offered accommodations so that they could continue working. And I know, folks in the disability community spoke up and said, "Oh, wait, you said that wasn't possible when I asked for that accommodation."
Right.
But so hopefully, we won't revert back to the old ways, and hopefully we can hang on to some of those accommodations.
Can you tell me, and especially I'm referring to your daughter, about universities, is migraine, and does it fall under the AD? I mean, how far have we gotten in terms of progress in terms of having migraines and other headache disorders falling under sort of ADA guidelines? And did she automatically qualify for accommodations because of that, or is this something that you still have to fight for?
I wouldn't necessarily say you have to fight for it. She's at University of Pittsburgh, hail to Pitt. So, you have to take the lead. You have to step up and explain your situation. But as long as you're doing that, they've been great in terms of working with her. So even when she was in school, before she went to college, she was actually at a private school. So they don't do the 504 plans because it's private, but essentially that's what her school was doing. And so it does fall under the ADA because it's not necessarily listed per se, but just by virtue of your own situation, you can demonstrate that it interferes with daily life. It interferes with your studies. So we were able to demonstrate how the ADA was applicable to her. And therefore, they did offer her accommodations. And so she actually, I don't know how the accommodations are structured on the university level, because she's actually doing a great job of getting the accommodation for herself. She's being an advocate for herself, yes. And so, that was one of the things she did, early on. She went and talked to the student services office, the accessibility office, and, she needed to file some paperwork and things like that. But again, like in her case, it was more so like getting a note from her neurologist, and they said, okay,
based on your sort of interactions with other folks, your online support groups, and I know that you're not currently working full time, but what sense are you getting from other folks about employers being accommodating to folks who need extra time or extra days off, or sort of an accommodation at their workspace, and what kind of struggles are they? I don't know if they speak about it in your groups that you're a part of.
A lot of the groups that I'm a part of, I do see people struggling, like asking questions, like how do I get accommodations? Well, and a lot of that is in terms of, I suppose, people filing for disability, which is a whole separate conversation.
Yes, it is.
So, I do see people talking about missing a lot of work, but I have to say, like with my own circle, I have a few friends who are disabled, but they're not working now, and so they're not receiving accommodations, and so I don't really have a lot to compare it to. I know even now, having had migraines for 30 years, people who've tagged along, so to speak, for 30 years still don't understand. And I'm not just talking about like they don't understand the pain that's in my head, which of course, nobody can truly know somebody else's pain, but they still don't understand what I go through, not only in terms of the illness, but just, day-to-day life, or, how much work it is to live with a debilitating disease.
And I would assume that sort of, there's, triggers for migraines, but I would assume at times it just sort of comes without sort of any warning, which probably makes it all the more challenging. What would the one thing that you would want anyone listening today, what would be some sort of takeaways about that you would like us to know, besides the advocacy work you're doing and about an understanding of folks with migraines? And I'm aware that you're not speaking for everybody, but just sort of based on your experiences, your child's experiences, and the work that you're doing now that you've had a chance to do your first headache on the hill, what would be the takeaways, and what do we all need to learn from the experience?
I think very simply, just believe the person. If somebody tells you they're in pain or they're suffering, or whatever their difficulty is, just believe them at face value, and trust them that they're doing what they can for themselves. Sure, you can offer them a glass of water or a meal, but trust that they know enough to seek help. Well, have you taken a Tylenol? It's, sometimes we're asked the silliest of questions, like, gee, I didn't think of that. I'm sitting here in excruciating pain, and it never occurred to me to try to alleviate my own pain. So, believe them, and trust that they are doing their best to not only take care of themselves, but to also, I suppose, meet your expectations. They're trying to work, they're trying to be a friend. And so, if they have to cancel, a get together with you, don't hold it against them, and know that they want to be with you, know that there's a lot of guilt involved with missing out on things. I don't know.
A little more compassion for all of us.
Yes.
Fantastic. Roberta, I want to thank you for your time today. For anybody who's listening who would like more information, you can go to the website. It's the Alliance for Headache Disorders Advocacy. There's a ton of great information there. And I appreciate your giving us your time this afternoon and to help educate everybody who's listening about the work that you're doing as an advocate. We're all advocates for our disabilities, and we would love to come back in about a year and see the kind of progress that you guys have made and the progress that the other folks with migraines and headache disorders are suffering at this time. Thank you so much.
That would be great. Ellen, can I just say one more thing?
Yes.
Thank you so much for giving me the opportunity to do this, because it just helps legitimize, to the outside world, it's saying, hey, this is real. This is a real thing. And I thank you on behalf of myself. Sorry, I might get a little choked up. Thank you on behalf of my late mother, who suffered for ages. And thank you on behalf of my wonderful daughter. So thank you all, to you and your producers. Thank you all.
Well, thank you. We appreciate we're all in this together, fighting for a better, more accessible world for everyone. Thanks, everybody.
Please visit our accessible website at www.disabilitypridepa.org. You can find us on social media at DisabilityPridePA on Facebook, Instagram, and TikTok.